Whenever I introduce myself as a cognitive behavioral therapist, I am often asked this question: what is cognitive behavioral therapy? In this video, I'm going to shed light on what cognitive behavioral therapy is and also give some common conditions that cognitive behavioral therapy can help with. My name is Patricia Obiero, and you're watching another episode of Patricia Speaks. Cognitive behavioral therapy is an evidence-based form of treatment that focuses on the relationship between your thoughts, your emotions, and your behavior. It is a form of psychotherapy that helps you to uncover some of your hidden core beliefs by interpreting what you think about yourself, the world around you, and other people. The word cognitive means your thoughts, your beliefs, your attitude, and it relates to all mental processes, mental imagery, reasoning, memories, and the list is endless. The word behavior means what you do. It relates to everything a person does, both action and inaction, how you interact with people, when alone, when problem solving, and the list is endless. The word therapy helps you to develop an awareness of what you are thinking. It relates to the systematic and professional approach to combating an issue, disease, disorder, or negative conditions that affect you. The main purpose of cognitive behavioral therapy is twofold. One, it helps you become your own therapist, and two, unlike the traditional type of therapy, it focuses on the here and now. Let me explain what I have just said. When I say that cognitive behavioral therapy helps you to become your own therapist, what I mean is that the moment you begin seeing a cognitive behavioral therapist, they will give you tools and homework in and outside sessions that will help you develop coping skills. So in other words, you learn the skills and you implement them yourself. For instance, if the condition that is making you see a cognitive behavioral therapist is anxiety or any type of phobia, it means that anytime you experience anxiety or that type of phobia, you don't necessarily have to call your therapist to be able to give you coping skills to take you through the condition at that particular time. But what it means is that you immediately remember the homework that you have been doing over time, both in session and out of session, and you also remember the tools that you have been equipped with. And these tools could be physical exercises, these tools could be breathing techniques, and the list is endless, or relaxation techniques, and the list is endless. When I say that cognitive behavioral therapy focuses on here and now, what I mean is that it gives focus on improving your present and future. It doesn't go to your past, unlike the traditional therapy. But that doesn't mean that once in a while the therapist may not go in your past to bring reference to something that is happening in your future. But it just means that the focus is not in your past. So if it is a form of anxiety or any form of phobia, then we don't need to go to your childhood upbringing or experiences to pick what happened so that we come and relate it to what is happening right now or attach it to what is happening right now. But it means that we handle anxiety or phobia or panic attack here and now. We don't focus on the past. So it is a therapy that focuses on the here and now. Let me give an example of what I mean. Cognitive behavioral therapy is only complete if there is a situation, or some people may call it a trigger. So there's a situation, and then there's a thought, and then there is an emotion, and then there is a behavior. And most of the time we only pick on the negative thoughts because those are the things that really affect how you think. So for the sake of this explanation, let's just call it a situation, not a trigger. The situation could be that you had a very, very bad time at work. You come back home, you're still experiencing a very, very bad day. And then you know that you have to drive to the supermarket or you have to walk to the supermarket because you need to buy something for supper. As you're driving out or as you're walking to the supermarket, you meet one of your very close friends, and for some reasons they ignore you. The thought then begins, and this thought is, what did I do to them? They don't like me anymore. Am I not good enough for them? Why have they ignored me? So that's the thought. And then the emotion or the feeling would be stomach cramps, or maybe for some people it could be headache, or for some people it could be that you feel sad or you feel rejected. And then the behavior could be that you decide that after I leave the supermarket, I'll go back home and I won't reach out to them. I will just keep quiet. I will avoid them completely. So that is just one situation. Another situation could be that one of your friends has posted something on social media and you commented on their post. They responded to every other person's post but yours. The thought is, did I say something wrong? Did I type something wrong? Did they hear that I said something wrong about them? Another example could be that your friend has posted something on their social media platform and you commented on their post. Then they responded to every other person but you. So the thought is that, did I do something wrong to them? Or did they hear something wrong about, or don't they like me anymore? Or what is going on? Then the feeling or the emotion that's attached to it could be that you feel rejected, you feel sad, or you feel unloved. And then the behavior could be that the next time they post, I will never comment again. I will never comment on their post. So basically, CBT is based on the principle that it is never the events that upset us, but the meaning we give them or allow them to have over us. I'll repeat that again. CBT is based on the principle that it is never the events that upset us, but the meaning we give them or allow them to have over us. Allow me to share with you some common conditions that CBT can help with. And these conditions are abandonment issues, addiction, anger management, anxiety, body dysphoric disorder or syndrome, that is BDD, chronic and acute pain management, chronic fatigue disorder, depression, eating disorders, free-floating fear, interrelationship issues, obsessive compulsive disorder, OCD, obsessions, panic attacks, panic disorders, past life experiences, poor self-esteem, minor personality disorders, phobias, post-traumatic stress disorders, PTSD, self-harming, social phobias, some medical conditions, substance abuse, and the list is endless. I hope that this video has helped you understand what CBT is and some of the common conditions that CBT can help with. Remember to like, subscribe, and share this video. Let's talk down here on the comment section. Until next time, goodbye.